You forgot your heart failure tablets this morning. Maybe you were rushing. Maybe you got distracted. Maybe you only realized when you were already at work or halfway through the afternoon, and now you're worried. Did you do damage? Do you take a double dose to make up for it? Or do you just carry on as normal? These are completely reasonable questions, and they deserve a straight answer. The honest answer is one missed dose of most heart failure medications is not a crisis, but how you respond to it matters, and some medications carry more risk than others when doses are missed consistently. So let's talk about what's actually happening and exactly what to do. I'm Dr. Jodie Ann Senior, a cardiologist and heart failure specialist. By the end of this video, you'll know what to do when you miss a dose for each of your main medications. You'll know what not to do, and you'll understand why consistent daily medications is one of the most important things that you can do for your heart, and why that matters enough to have a system. First, why consistency matters so much in heart failure. In the last video, I talked about why heart failure requires multiple medications and why the benefits build over months and years rather than days. That slow accumulation of benefit is precisely why the consistency matters so much. Unlike a pain tablet where you take it, it works, and it leaves your system, heart failure medications are working continuously in the background. They're blocking harmful hormones, protecting your heart muscle from ongoing stress, managing fluid at a hormonal level. That protection is cumulative. Every dose you take is contributing to that longer-term outcome. And every dose you miss is a small gap in that protection. One gap in an otherwise consistent routine is not going to undo your progress. But gaps that happen regularly or that go unnoticed and become a pattern can allow the conditions that damage the heart to creep back in. So the goal isn't perfection. The goal is a system good enough that missing a dose is the exception and not the rule. What to do? Well, medication by medication, let's be specific, because different medications carry different levels of concern when a dose is missed. Your ACE inhibitor, ARB or ARNI, the pillar 1 medication, things like ramipril, candesartan or Entresto. If you miss a dose, take it as soon as you remember, unless it's almost time for your next scheduled dose. In that case, skip the missed dose and take the next one at the usual time. Do not take a double dose to make up for it. Missing one occasional dose has a low short-term risk. What it allows is a temporary creepback of the hormonal and blood pressure burden your heart was being protected from. Not dangerous acutely, but worth getting back on track as soon as possible. Your beta blockers, the second pillar, carvedilol, bisoprolol, metoprolol. Same rule. Take it as soon as you remember, unless it's almost time for the next dose. Never double up. Beta blockers carry a slightly higher short-term concern if missed repeatedly. Your heart rate and blood pressure can rebound. And if you've been missing several doses in a row, you may notice palpitations or feel breathless or unwell. If you've missed more than 2 consecutive doses of your beta blocker, I'd recommend contacting your care team rather than simply resuming where you left off, especially if you're on the maximum dose. And this is worth saying clearly. Never stop a beta blocker abruptly, even accidentally, over several days. If that's happened, get advice before restarting. Your MRA, spironolactone, eplerenone or finerenone. Take it as soon as you remember. Skip it if it's nearly time for the next dose. No double dosing. Missing one dose carries a lower short-term risk than missing your beta blocker, but it still matters for your long-term fluid balance and cardiac protection. Get back on track as soon as you can. Your SGLT2 inhibitor, Forxiga or Jardiance, take it as soon as you remember on the same day. If you only remember the next day, skip the missed dose entirely. Don't go back and take it the following morning along with that day's dose. One missed dose has minimal immediate impact. The benefit of this medication is delivered through consistent daily use over a long period. Get back to your routine. There are also times when it is important not to take your SGLT2. This is when you are having an operation or cannot eat for a period of time, like fasting for a procedure, or if you have become unwell. In these circumstances, get guidance from your medical team on when to stop your medication. Your diuretic, furosemide or Lasix. Take this as soon as you remember if you've missed your dose. But if you take it late in the evening, it will likely make you go to the toilet frequently overnight. If you remember your morning diuretic at 9 or 10 at night, skip it entirely and resume tomorrow. Taking a diuretic late in the day and then being up multiple times through the night isn't helpful or pleasant. And if you are older and frailer, getting up multiple times at night might be less safe. If you miss your diuretic, you may notice a little more breathlessness or fluid retention than usual. Weigh yourself and check your zone. If your weight has gone up more than 2 kilograms or if your symptoms are worsening, contact your team. I often tell my patients if they have a morning appointment or something they have to go out for, to take their diuretic when they get home. And this might be in the early afternoon or even mid-afternoon. That's quite acceptable too. The one rule that applies to every medication: never take a double dose to make up for a missed one. I know it feels logical. You missed one, so take 2 to catch up. But most heart failure medications don't work that way, and definitely don't do that with blood thinners. A double dose doesn't deliver twice the protection. It delivers twice the side effects and can cause a significant drop in blood pressure, cause dizziness or other problems that are far worse than the original missed dose. 1 dose missed, 1 dose skipped, back to your normal schedule. When to contact your team? Well, contact your GP or heart failure nurse if you've missed more than 2 consecutive doses of your beta blocker. You've missed several days of any medication and aren't sure whether to restart at the usual dose. You missed your diuretic and your weight has gone up more than 2 kilos, or your breathlessness has noticeably worsened. In this case, you need to contact your team anyway because you're not feeling so well. If you feel unwell in a new way after missing doses, particularly heart palpitations, increased breathlessness or chest discomfort, definitely contact your team. How do you avoid missing doses in the first place? You avoid it if you've got a good system, because a good system beats willpower every time. Let's be honest about something. Most people who miss medications don't miss them because they don't care. They miss them because life is busy, routines get disrupted, and tablets are easy to forget when you're not feeling so well. Or you can miss them because you feel really well. Willpower is not a reliable strategy. A good system is. A few things that genuinely help. A weekly pill organizer filled each Sunday so you can see at a glance whether you've taken that day's dose. A phone alarm set to your medication time every single day, not just on the days you remember to set it. Keeping your medication somewhere visible, somewhere that prompts you, next to something you do every morning without fail, like have your coffee or near your cup or your toothbrush or your kettle. The goal is to make taking your medication the path of least resistance, not a decision that you have to actively make each day, more a habit. And if side effects are making it genuinely hard to take your medications consistently, then please tell your team. There are almost always options, but only if they know. To bring this together, one missed dose of most heart failure medications is not a crisis, but how you respond matters. Take it as soon as you remember. Never double up. Never stop a beta blocker abruptly over several days without guidance. Check your weight. Check your symptoms if you miss a diuretic. And contact your team if you've missed multiple consecutive doses, especially if it's your beta blocker, or if you feel unwell, and then put a system in place, because your medications are doing quite important cumulative work for your heart every single day. They deserve a reliable routine. My free heart failure tracking kit is linked in the description below. It includes a daily symptom diary and the 4 zones weight action plan, so you know exactly what to watch out for if your symptoms shift after a missed dose. And if this video helped you, please subscribe. I release a new video every week, all designed to give you the clarity your cardiology appointment maybe didn't have time to.